Guys, I'm actually Puerto Rican, so I'm pretty loud. I don't think I need this thing, but well, thank you for being here today. Obviously, we're going to be talking about controversies and emergency ultrasound. The debate rages on. Now, some of you actually know me. I'm the ultrasound director for a pro-hospital residency program. Starting on July, I'm actually transitioned from that position. I'm going to be program director for a new residency program. So thank you for actually having me here. And I want to just, all of you guys that know me for years, to actually get the first detail on it. Now, obviously, my theme here is going to be about ultrasound and extension of the physical exam. And I think that who hasn't heard that before? I think everybody has it, right? I'm just going to bring the debate of why I think that's actually true. Now, there's a lot of things that you can actually put in a slide, right? And Dr. Nomura was supposed to be my debate, but thank for Dan to actually cover for him. He couldn't make it this year. So I'm actually going to start basically saying that because of the stethoscope being part of the present, this is how things are actually making this sound like it should be part of the physical exam. Okay? Now I have to start. I have no disclosures. I just wish I did. Okay? And I'm going to go back in time. So if I have like a backup machine, I would try to go as far as I can. Oh, no, that was later. Sorry. This was actually a couple of years ago, or somebody in the back right there. And before that, some of the other controversies we had in the past. But let's go really farther back in time. So the physical exam has actually been part of what a physician is, right? Now, for centuries and for millennia, right? It has been kind of the center of practice for medicine, right? Physicians and healers actually use physical exam to be able to decide what a patient has and make differential diagnosis with it, right? And obviously we know that's supposed to be kind of an art that you learn and you can actually pass that to other people. So I actually found a quote that I think is very important. This is actually an article from 1873. And I want to read just a paragraph about here, because I think that a lot of you guys are going to understand what I'm saying now. Now, when Laennec actually was the one that actually developed the first stethoscope, right? And it was in 1816, okay? For him, actually, that actually changed the way that we see medicine and how we actually now can say that the stethoscope became part of the physical exam, right? Look at this quote. It's actually kind of interesting. The next time now has proved that more practical value of the ausculter of a greater interest of auscultation than the differential stethoscope. It has enabled the former to arrive at a correct diagnosis in many cases of thoracic disease, where without its aid, he would have been in doubt or even in error, while to later it has demonstrated certain interesting loss regarding the sense of hearing. The instrument, moreover, is very portable, simple in construction, inexpensive, and to those who are acquainted with the use of the ordinary stethoscope, not difficult to master. These are merits sufficient to recommend it to the notice of every ausculter, but strange to say, although most physicians know Dr. Scott Allison's stethoscope by name, many have not seen it, few have used it, and fewer still have taken the trouble to learn its use. Does that sound familiar? I think that that's what I have with all my physicians every day, right? But this actually came in and changed the way that we do physical exams, right? So what is the present? So we just talk about AI. Super exciting, right? But what is this? Handheld devices. Not only that, they are so portable that where you can carry them? You can actually put on your pockets. Even you can actually put it around your neck, right? So it looks pretty cool. You can actually probably just change it and you say, this is actually the stethoscope of the future, right? So it's actually being close more because the media has continued trying to push this through different ways, right? As you can see, it's basically so small that you can make your own diagnosis. And I'm going back to the AI thing, like, well, what are you going to do with that once you find what's going on with it, right? So these are just a couple of papers, just like I was able to find through. You believe what you see is what you hear, cardiac examination stethoscope that we use. I like this one, portable bedside ultrasound, the visual stethoscope of the 21st century, right? And this is more and more things that actually have come out, right? So the literature is out there that basically says that probably the stethoscope is dying, right? And there hasn't been really any improvement since the actual improvement of the stethoscope to actually be able to be used. So what has been the impact of point-of-care ultrasound on the physical examination? That's a good question, right? And if we can answer that, probably that actually can help you with your argument. So where is that we're using it most? To teach who? Now, medical students. Now, yeah, we all have residencies, and we teach 16 residents, but now I have classes of medical students of 300 people, okay, that they all have to go through ultrasound. And they learn it where? Anatomy, where they use it, in second year on physiology and pathology, and then they actually improve it and use it on third year and fourth year, use it on clinical practice, right? So this is basically just one of those papers of the implementation of ultrasound on physical exams. So what they actually did is that they have two different populations. One that was going to take OSCEs that actually had ultrasound experience, some of them that didn't have ultrasound experience. And interestingly enough, you can actually see that there was actually an improve on the pre-ultrasound group on their OSCEs, meaning that they were actually doing better when they actually got the part of the ultrasound, right? That makes kind of sense, right? So we can continue going on, right? Now, using simulated-based training or to incorporate thoracic ultrasound physical examination. Well, how good is actually a stethoscope to find anything, right? Like, who actually, I go to my practice, I think that I look very nice with the ultrasound, but with the stethoscope, depending on the physician, maybe, because it could be a nurse too. So it just depends, right? But there's another study here, right? Basically teaching just hands-on on medical students and seeing how they actually do pre and post of their knowledge on just pathology and seeing how they were actually doing after that. Now, we do know how good is ultrasound. Now, this is actually a recent paper about just for CHF, right? And very nice search. We went through a bunch of data banks to see how ultrasound compared to some things, symptoms, history, examination. Now, you can see for symptoms, you have a likelihood ratio that's between 1.9. For history by itself, it's about 3.4. Now, when you go to physical examination, the likelihood ratio is just about 4, right? So that tells you that you are still making the diagnosis, you're okay. When you actually put point-of-care long ultrasound, you actually see the difference, right? Your likelihood ratio goes up 7.4. And it might be actually that you have to just incorporate more than one thing. If you actually use your history of physical exam with the ultrasound, that could be even higher, right? So I could try to teach somebody to do this and try to hear this, right? Or I can show what's actually on the lung. And still they can actually use it, right? They can actually do both. And now you know what the patient has, and you just made the diagnosis. So the same thing, you can actually use it for in cardiac anatomy, the same kind of modules, they divide it. And we're currently running a study that we have taught two groups, right? Pre and post ultrasound, and we are finding the same thing. They're doing better with physiology and everything else. But I can do basically the same thing. I can try to teach somebody to hear this. I can barely hear it. That's a real life, right? That's actually the ER, right? Or I can do this and show the patient not only how it actually interacts with your EKG tracing, I can actually see what's going on. I can see where the flow is going. And if I really want to hear anything, I can still hear the heart, right? So as you can see, there are so many applications of how you can actually put this in perspective. The same thing for abdominal examination. Again, using ultrasound and incorporating it into the actual practice demonstrates that medical students are getting better and they're actually using it as part of their exam, right? And of course, I can actually try to do something like this, or I could actually go with the ultrasound and show that I can actually find what the pathology is in the patient, right? So, I don't want to forget all the specialties because this is actually not only coming from our institutions, you actually can go to internal medicine and you can actually see how they actually basically are saying that interns for internal medicine are getting courses for ultrasound, and guess what? They're also kind of remembering that knowledge and it's actually making them better physicians. So this is how I think that they are basically incorporated in this physical examination part of it. Now, I think that this is a big one, right? I think the major argument is, like, if you say that it's a procedure, and then what about billing? Now, I have to be completely honest with you guys. This is actually Medicare data for 2012. I tried to look for something more recent, but again, out of 52,926 EM practitioners, 391.7 received limited ultrasound reimbursement. Now, if you don't believe me, this is where actually all the physicians are, and this is how they're getting reimbursed. Okay? So, if that's the argument, I think it's a very poor argument, because the reality is that we need to make sure that we improve patient care. And how do you improve it? Well, if you was at the bedside and it's part of physical exam, you can definitely say, this is what's going on, and then I can improve my accuracy. Okay? And I think this is just a little bit more data, so you can actually see it there. Okay? Now, the real question I want you guys to ask is whether are we being resistant to make ultrasound part of the physical exam? Maybe that's going to be different. Just like the stethoscope actually changed the way that medicine is actually being taught, maybe ultrasound being more onto your hand is going to do the same thing. Questions? Concerns?
Sir, I was an office practitioner. Are there any primary care physicians or even who are actually using?
Tons of it. Like actually almost every. I only have 20 minutes, but actually I have 10 minutes. So literally, there's so much data out there of every specialty incorporating ultrasound. Not only primary care, internal medicine, family practice, everybody. Okay. Thank you, guys.